Welcome to Voices of Change, a podcast for the Get the Medications Right Institute. We are on the cusp of a new era of specialty medications and gene therapies that will transform care. But we are also seeing tremendous waste. Annually, more than $528 billion is wasted, and 275,000 lives are lost due to non-optimized medication use. Misuse, overuse, or underuse of medication therapy can lead to treatment failure, a new medical problem, or both. Consider some of these statistics. 1 in 10 Americans take 5 or more prescription drugs. More than 75% of all physician office visits result in a prescription for medication. 50 to 75% of patients do not take their medications as directed. But there is good news. There are opportunities to control the loss and waste, whether you are involved in receiving, paying for, or delivering care. Living in a world where patients get the right medications the first time is attainable. That's what we're doing at the Get the Medications Right Institute. In this episode, Dr. Julie England and her patient, Mike, sit down to talk with GTMRx Executive Director and co-founder Katie Capps about Mike's journey. Through a systematic approach to evaluation and management of his medications, Dr. England tells listeners how comprehensive medication management combined with PGX helped target the correct therapy for Mike. PGX is the study of how a person's genes affect the way they respond to drugs. When utilized as a tool through the service delivery process of care that we call comprehensive medication management, it puts the patient at the center of care, allowing us to target correct therapies and deliver care that is precise and personalized. You will hear Mike's story before and after consulting Dr. England and his courageous battle to get his medications right. Dr. England also explains how PGX testing works to support the process of care she uses with her patients. Hear more from Mike and his doctor on this episode of Voices of Change.
Hi, this is Katie Capps, co-founder and executive director of the Get the Medications Right Institute. The Institute works to ensure every patient receives the right medications at the right time in the right dose. Sharing real-world examples of how this is working in practice is essential to educate and inform physicians, clinical pharmacists, and patients. At the Institute, we believe that appropriate use of medications requires a team working in collaboration to optimize medications through comprehensive medication management. Today, there are tools like pharmacogenomics testing that can be used by the team to target correct therapies, offering a more personalized approach. I'm excited to share with you a story about a patient named Mike. Mike's journey is fascinating. But before we get started, let me give you some background information. 80% of the way we treat and prevent illness is through medications. Optimizing medication use requires a systematic approach to ensure that each medication a person is taking is effective, safe, indicated, and appropriate for the individual. It also requires considering other medications that person may be taking, the individual's ability and willingness to take the medication, their genetic makeup, and other factors. To accomplish this, we need a rational process of care. We call that process comprehensive medication management. Used in conjunction with insights gained from diagnostics like pharmacogenomics testing, we can gain some pretty amazing results. Pharmacogenomics testing with CMM can lead to reduced adverse drug reactions, reduced cost, better treatment outcomes, improved adherence, higher patient satisfaction, and the ability to achieve clinical goals of therapy much more quickly. Let's hear how this really works from a physician and a patient. With me today to tell Mike's story is Dr. Julie England, Medical Director of Medical Affairs at OneOme. Julie is a board-certified physician with over 15 years of clinical experience in family medicine. On a daily basis, she interfaces with a variety of patients with a host of medical and medication-related issues. Dr. England became interested in a more personalized approach to medication use as her practice grew, and she's opened a small concierge lifestyle precision medicine practice. It's so good to speak with you today, Julie.
Thank you, Katie. Thank you for having me. It's a privilege to be here with the GTMRx folks. And I'm also glad to have Mike with us. I'm very grateful for his story today. I think it's very valuable. So, as Katie mentioned in her introduction, the potential of CMM and pharmacogenomics is vast. With this technology, we can help prevent adverse drug reactions, which are side effects from medications. We also can look at medication optimization with dosing to get better treatment outcomes. Also, we've known through studies that when we do this sort of testing, patients feel more confident in their medications, and we have improved adherence with patients. And then looking at the big picture, we also can reduce total healthcare costs and switch our paradigm from reactive to preventive. So I would like to share with you today Mike's journey. Mike is a patient of mine. Mike is a 37-year-old male with a long-standing history of anxiety. Mike has suffered with anxiety since his teens and has been off and on multiple medications, many first-line medications without success. He also suffered many side effects, including insomnia, weight gain, and hot flashes. Due to these side effects, Mike was at a crossroads of feeling really frustrated with the side effects that he suffered and had been apprehensive of going on new medications. The last several months, his anxiety has been escalating as he was off all scheduled medications, and he also developed panic attacks. So now I will turn it back over to Katie so you can understand more of his journey.
Mike, thank you for joining us today. We're delighted to have an opportunity to speak with you. In your own words, can you tell us how your medications were making you feel?
When I was on my prescription medication, I was having trouble sleeping, weight gain, like Julie had mentioned, hot flashes, and actually increase in anxiety.
So how did that limit your life, Mike?
Well, it made it difficult to hold a job, work. Staying up all night and then having to get up early and the next morning to work, and then struggling through panic attacks all day at work. So it made it difficult just to function at a base level for me.
Yeah, and I think there are a lot of people in a similar situation. So that must have been very, very difficult for you in terms of just activities of daily living, right? From
For
that
sure.
standpoint. So during that time, Mike, what kind of medical care did you seek? What, in terms of your journey towards some solution, what were the cues that things weren't going as they should be going? What kind of medical attention did you seek during that time?
So during that time, I had multiple trips to emergency rooms with panic attacks that would not decrease. And I had a few ambulance rides. I had multiple visits to psychiatrists, primary care physician, psychiatrist, therapist. That in itself almost consumed my life, as well as the anxiety and the side effects from the medication I was on.
Right. And what was the period of time? How long did this occur, Mike? Over what period of time did you deal with these issues and the problems that you've expressed?
So the last one was about 6 years, but it had been on and off since I was 15. I would go on a medication, and then within a year or so, it just seemed like everything changed, or it would get worse. The anxiety would get worse, or to have side effects that just weren't kind of working for me. And so it was probably there was a good probably 5 or 6 year run of endless appointments and trips to the ER.
Which that's not fun, and that's difficult. And it's certainly not only from an economic standpoint, but from just a quality of life standpoint, gets in the way of so much. So,
correct.
Mike, thank you for sharing with us how your life was impacted by suboptimal medication use. Let's hear a little bit more about how things changed for the better.
So now that we've heard a little bit more about Mike's story, I'd like to go back and just talk about the journey that we had together with pharmacogenomics. So as I'd mentioned before, Mike suffered from severe anxiety, and Mike was referred to me as I had started doing pharmacogenomics in my practice. When Mike first came to me as a patient, he was off all scheduled daily medications, and his anxiety was at an all-time high. And as I've mentioned, he was fearful to try another medication due to the severe side effects he had suffered in the past. I discussed pharmacogenomics with Mike, explained to him what it was, and he accepted the idea. He appreciated the fact that we would reduce trial and error and have a starting point for him. And he liked the fact that it was going to be a unique plan for him.
Mike, prior to meeting Dr. England, why did you decide to stop taking your medications?
I decided to stop taking my medications because I felt that they were causing more issues for me, side effects of not being able to sleep, the fatigue, that sort of stuff, and the increased anxiety almost seemed worse than where I was prior to starting the medication.
Sometimes the solution to the problem is worse than the problem, right?
Right.
So,
correct.
And that's kind of what you experienced in that situation. So when you met with Dr. England, what are some of the questions you had about pharmacogenomics testing? I mean, what were some of the concerns, questions, opportunities you saw with that?
The biggest thing is that prior to meeting with Dr. England, I had been seeing, it was about 2 years I was off all medication, and I had been seeing, again, more psychiatrists, therapists, primary care doctors, and each time I was presented with a medication or plan, it didn't seem like it just seemed like they were just grabbing out of the air, and it was more of a guess. And I was really reluctant to do that because my experiences with medication in the past. So when I met with Julie, it felt like a more tailored approach to something. It gave me more confidence in selecting or seeing a list of medications that I knew that would be a good fit for specifically me.
Yeah. And I think you make a good point. There are people out there that may see multiple physicians. You may be on multiple different medications, and it could be an issue or a problem with no one really coordinating your care and no one focused on what your needs are. Did you consider using pharmacogenomics to be an easy decision? I mean, what kind of questions did you have about it? Or was it an easy decision from your standpoint to use that kind of pharmacogenomics testing as insight to target the correct therapies, but also the opportunity to discuss it with an informed physician?
It was an easy decision for me because it was something different, and versus just, like I said, kind of just pulling things out of a book, and seemed like everything else was more guesswork. And this seemed, like I said, more geared towards me specifically. So it kind of gave me the confidence I needed to move forward with medication, because I knew I needed medication, but I was really reluctant as to which one. And I didn't want to go down that road of trial and error kind of thing.
Right. And I think you hit it right on the nose. The trial and error approach, a more personalized approach, which is what was offered in terms of the opportunity with pharmacogenomics testing, was something that you saw as a real opportunity that you had not experienced in the past. So thank you, Mike, for giving us that insight. Julie, can you tell us a little bit more about pharmacogenomics testing and how it can be used as a tool to get the medications right? I mean, what insights does it provide, and how did it help you plan Mike's future care?
Sure. So I think the first important thing to understand is, what is pharmacogenomics? And pharmacogenomics is the blending of two sciences: pharmacology, which is the study of drugs, with genetics, which is the study of genes and their function. And the important thing to know is that these are not rare mutations. Most of us, more than 90% of us, are going to have these variants at these genes that impact how we respond to medications. So again, I really think that's a very important point, is that these are not rare findings. These are relevant. These variants amongst our genes are relevant to the large portion of the population of how we respond to medications. So as a physician, I can use this information to look at, how is this drug processed? Is a patient a slow processor? Are they a fast processor? Are they at risk for, side effects, which are known as adverse drug reactions? So I explained to Mike that it's a very simple test. It can be done with a blood test, but also a cheek swab, which most patients opt for. So the test is just a very 30-second quick cheek swab, and then it's sent off to the laboratory. So Mike consented to pharmacogenomics and we sent the sample off. So some of the information that we can gain from pharmacogenomics is how a person processes medication. So someone can be what's known as a poor metabolizer, which simply just means that they process a drug more slowly. That can cause the medication to build up in their system, in their bloodstream, and then put them at an increased risk of side effects, which of course then can result in office visits, urgent care visits, ER visits from that adverse drug reaction. Also, persons can be on the other end of the spectrum. So someone can be a fast metabolizer. And then what can happen is the medicine doesn't stay in their system long enough to achieve the desired effect. So there's much more insights that we can gain as physicians from pharmacogenomics, but this is just some of the information that we look for. So we received Mike's pharmacogenomics results back, and it revealed very important insights. Not only did we find out where he was a fast or slow metabolizer, but also where he was a normal metabolizer. And this is very valuable information as well. To know where someone is a normal metabolizer is a great place to start with a medication, especially in Mike's case where he suffered a lot of adverse drug reactions, side effects. Choosing a medication based on his PGX results, indicating where he was a normal metabolizer, is where we decided to begin. And that gave Mike confidence. Again, he was very apprehensive about suffering more side effects because that was equally as bad to his symptoms of anxiety. So knowing where he was a normal processor of this medication gave us a good starting point and Mike the confidence to begin his treatment. And I'm happy to report that with this first medication that we tried, Mike has remained on this medication for 2.5 years. He is now able to work, travel, and enjoy life with his family. And for Mike, this has been really life-changing. And now I'll turn it back over to Katie, where we can hear more from Mike's story.
Thank you, Julie. So, Mike, we've heard from Dr. England how she worked through the pharmacogenomic testing and the result of that and was able to find the right medication for you. And as you said earlier, create a more personalized approach to medication use for you. Mike, in what way did the pharmacogenomics test results and the consultation with Dr. England change your thoughts about medication use or using medications?
Well, it gave me, like Julie said, more confidence, as I was very reluctant to even pick any medication because of my past experiences. So it kind of just gave me the push that I needed to be able to start another medication. It just gave me a little more confidence.
I mean, obviously, if you've been on this medication regime for 2.5 years, you've certainly had the benefit of a looking back from that standpoint. You know, it's interesting because oftentimes when people fail medications, they blame themselves, okay? Not recognizing what's going on and not recognizing what Dr. England pointed out, and that is people metabolize medications differently. So, I mean, the science has caught up with our ability to ensure that the medications are the right medications for the individuals. So our body is as individual as our thoughts. So what advice, Mike, would you give someone like you experiencing medication therapy problems? I mean, what would be the top 3 things you would say to them if you met someone that was experiencing problems similar to yours?
My first thing would be to find locally somebody who can perform this test for them and do the same thing I did. Because, I mean, honestly, had I not taken this test, I feel like still be continuing struggling, a couple more years, because this really was honestly the make or break situation for me.
After years of frustration of being on the wrong medications and years of frustration with having to go back into the medical system and saying, this isn't working, I'm just going to stop these medications. It had to have been very gratifying for you to find a medication regime that worked for you and a physician that understood not only the implications, but the application of that. So if someone seeks you out for advice, where would you tell them to start?
I would have them look into this program because, and find, it was almost like if you're out there on your own trying to do this, it's very difficult. You don't have an advocate. You don't. And when I had met Julie and gone through it felt like Julie was an advocate for me as well as this test. It felt like I had two things on my side to help, move me forward, and versus just, like I said, the endless trips to different psychiatrists and doctors and ER and the financial burden it caused stress on me. And then it seemed so simple that this, inexpensive in a way test was going to give me the answers that I needed. And it did.
Right. And I think you hit the nail on the head, Mike. It's a combination of the medical care that you received from Dr. England and the companion and complementary diagnostic test, or the pharmacogenomics test, that offered her insight that she could apply her knowledge of your medication regime to put you on a more personalized medication regime and medications that were right for you. So, Mike, I want to thank you for sharing your story with us. And I want to turn it back over to Dr. England to get a little bit more of information on pharmacogenomics testing as a tool for comprehensive medication management. What do you believe are the success factors in that? We've heard a lot from Mike about his reassurance from you and the fact that not only were you there to advocate on his behalf, but you knew what to do to get him on the right medications. So what are the success factors, the top 3 success factors that are duplicated in your practice every day, Julie?
So as we learned from Mike's story, we know that pharmacogenomics had a significant impact on his life. So not only did it decrease his total healthcare costs through less clinic visits, less ER visits, less ambulance rides, it also improved his personal life. He's able to work now, travel with his family, able to go to dinner. So the benefits are tremendous for Mike. I think it's also really important to note that pharmacogenomics is part of comprehensive medication management. So pharmacogenomics is a very important tool, but it's even more valuable when it's used in a broader manner with the CMM, the comprehensive medication management. So pharmacogenomics, again, as a provider, can give me very useful information about how Mike processes medication. But we also, as we've been talking about this whole time, is that we want to look at the big picture. We want to make this an individual more precise. So in the midst of CMM, we're going to be looking at, when I met with Mike, we were talking about his diet, how diet may impact medications, drug-drug interactions. So pharmacogenomics is a very valuable piece, but it's one piece of the puzzle. And when you insert that into the broader picture of looking in detail at how drugs interact with your environment and your genetics, that's when it becomes most valuable. So based on my experience with Mike and my other patients and helping other physicians implement this into their practice, there's 3 areas that I have identified as factors for success. And the first one is education. And it's not only education of the patient, but also of the provider. A lot of providers have not had training in pharmacogenomics. And so really helping them to find out where there's resources like GTMRx and other guidelines for pharmacogenomics is a really important factor. Again, we want to make physicians feel comfortable with this. This is a new area of technology. A lot of physicians weren't trained in this, but there are resources out there. And then also, too, explaining it to the patient, kind of demystifying it for the patient, explaining it on a level where they're going to understand how this test can help them. The second area is, of course, cost of the test or payer coverage, as Mike had mentioned. The cost has come down over the years. What used to be thousands of dollars is now hundreds of dollars, but we still want to make this equitable for all. So one of our major goals is to have payers, insurance companies pick this up, because a few $100s maybe for someone who it is affordable, maybe not for others. So really making sure that insurance companies will cover this test, and we're getting a lot of traction in this area. And then lastly, I think it's really important that when we're looking at these tests, that we're not looking at single genes. If we look at what we call a multi-gene panel or many genes on a test, this is impactful because your genes, your genetics do not change over time. This is going to be your code for life. So we can use this information over and over. So in Mike's case, we used it for his anxiety medication. But in the future, we also could look at it if he develops high blood pressure or high cholesterol, we can use this information as well. So the lessons I've learned as a provider from pharmacogenomics is that it's a clinical tool to help inform me when I'm writing a prescription, and in the broader sense, using it as part of a comprehensive medication management plan. It's a more precise way to prescribe medications to achieve optimal care for the patient. And I think the best way to use this is proactively. So if this is already on the chart versus, maybe in Mike's case, if he would have had this test years before, the trial and error would have been less. So really having this switch from a reactive paradigm to a more preventive paradigm is where I see this best utilized.
Yeah. And I think Mike would agree, Julie, that a trial and error approach to medication or his experience over his lifetime before he started seeing you is something that he would trade. We would much rather have gone into a more personalized approach to his own medication use in order to restore his quality of life. So at this time, Julie, I'd like to ask you one final question and ask you to offer concluding remarks. What do you think the future holds for the expansion of a more personalized approach to medication use in management of medication therapy problems?
Yeah, it's a great question, Katie. So I think the future is very bright. There's more and more research coming in every day about pharmacogenomics and how your body can process medications, respond to medications. So there's a very bright future. I think that we're moving away from the one size fits all approach. And this is where that is really what precision medicine is. It's moving away from that paradigm that if you have diabetes or hypertension, we're going to treat everyone the same. And we know now from pharmacogenomics and comprehensive medication management that that's just not the case. Everyone is unique and we need to tailor their treatment. So I really see this as a future, again, very bright. Evidence is growing every day. I think how this will be most successful is when it's a team approach. So you really want the provider, the pharmacist, the nurse, to really get the best results. I see that's how it's going to work the most. And then of course, with healthcare data, that machine learning and big data, the more information we have, the better decisions we can make for the patient.
Yeah, and I think clearly Mike has indicated and outlined that he felt not only was it a personalized approach, but he felt very much in the center of the treatment decisions that were being made. Mike, I'm going to give the final word to you. You've offered us so much insight, and the words that you have used are things like it was a eureka moment when I realized that there was a test available. You've also discussed how important it was to have Julie as a partner in your care, so she could apply not only her knowledge, her medical knowledge, but the results of the pharmacogenomics testing to help you in your specific situation. If I were to ask you, Mike, what the one single biggest benefit was of taking this journey, what would that be?
I think it would have to be that I felt like I was not alone.
I think that's a terrific response, Mike. And I think based on what you've discussed with us today and what Julie has shared with us, it's very clear that a more person-centered approach, not only to the management of an individual's care, but to the management of their medication, can lead to some amazing opportunities. So with that, thank you both very much for sharing with us your journey. It's amazing to see what can be accomplished when we optimize medications with comprehensive medication management and pharmacogenomics testing and practice. If you'd like to learn more about the Get the Medications Right Institute, please visit our website at www.gtmr.org. We're committed to appropriate use of medications and gene therapies. Feel free to contact us. Until next time, be well.
That marks the end of this episode of Voices of Change. Thanks to our listeners for tuning in. The Get the Medications Right Institute recently released a series of tools from our experts to support a variety of stakeholders in the path toward medication management reform. You can learn more about how to get the medications right and access the tools and our blueprint for change at www.gtmr.org. Until next time, be well.